Aortic stenosis is a pretty common condition affecting about 10 to 20% of the world's population. What it basically is, in a nutshell, is the calcification of the aortic valve. The aortic valve is the main valve of the heart, which governs how much blood comes directly out of the heart and goes to the rest of the body.
The best way to understand aortic stenosis is thinking of as a faucet in your house that has built some calcium deposits on it, and when you open the faucet now, instead of getting a stream, you get dripping of water. So the aortic valve is the outlet of the heart. When it builds debris on it and calcium and so on, it becomes very, very tight, and so overwhelms the heart with pressure. Eventually, you can't generate enough output of blood.
There's usually a triad of classic clinical symptoms that arise from aortic stenosis. That is being shortness of breath, lightheadedness or dizziness, as well as chest pain. Oftentimes, the most common presenting complaint of aortic stenosis is fatigue.
What we found is that once patients actually present with symptoms, their chances of dying are almost 50% within 2 years.
Most patients have a good doctor, and the doctor puts their stethoscope on their chest and they hear a murmur, and that murmur then is evaluated with an echocardiogram, and then diagnosis comes from that venue. For the patients that don't have regular medical care, then unfortunately some of these patients come when symptoms are unbearable for them.
Once severe aortic stenosis is diagnosed, the patients are often referred to our multidisciplinary heart team, where we meet with cardiac surgeons and structural interventional cardiologists to determine the best treatment approach. When patients develop symptoms in the severe aortic stenosis range, this is often time for intervention, and we use the markers from echocardiogram to determine the timing of the intervention.
Surgical aortic valve replacement is your tried and true standard of care, wherein patients are put on a heart-lung bypass machine, their chests are open, the existing aortic valve is surgically explanted, meaning removed, and a new valve is inserted. The procedure takes a couple of hours. Patients are usually in the hospital for 3 to 5 days, and then typically takes somewhere between a month to 2 months to make a full recovery.
TAVR, or transcatheter aortic valve replacement, is a percutaneous or endovascular treatment option for aortic stenosis. It allows the patient to return to activities much faster than SAVR procedure. It's usually a 1 to 2 day hospital stay, depending after the procedure. Of course, it's minimally invasive, so the recovery time is much faster. The long-term benefits are very similar to SAVR as well, but the upfront risks are lower in terms of bleeding and stroke risk.
Other repair and replacement techniques that are available from a structural heart or non-surgical approach include mitral valve repair and replacement, in addition to tricuspid repair and replacement. We're very excited and proud to offer patients all of these different technologies at Valley.
Valley has demonstrated and demonstrates day in and day out the benefits of a multidisciplinary heart team approach, which means, again, not one person makes the decision of what is going to happen, but a group of experts do. And so at the end of the day, when we come up with a recommendation for you as a patient, is fundamentally bespoke and tailored to you as an individual.
And we really function well together to try to treat the patient with an optimal treatment approach, always keeping in mind their lifelong management to this disease.
Unquestionably, the best part of my job is when someone has been changed by the operation. When you see them being able to do anything and everything that they want, that is the job. I mean, that's why we do what we do.